extremely privileged and honored to be introducing Amy Joyce Smith. After Dr. Sweeto's talk, we so had a PANDAS child at the time of her onset. My oldest daughter, Paige, was 7 when she had her sudden acute onset with the severe fear of vomiting, severe separation anxiety, panic, aggression, regression, and the list goes on and on. Within a week, my once self-assured, independent child was filled with so much anxiety she could no longer go to school. My pediatrician's inclination was that Paige had been molested. So my family and I had to sit on that for quite a while. But then she went to an outside resource, and they said, let's try a blood test. It could be associated with strep. And that's how our PANDAS story began. Our pediatrician is our miracle, as she had never heard of PANDAS, but sent out mass emails based on Paige's initial blood work to connect us with somebody that could help. Diana Pullman and Amy Joyce Smith were the answers to our prayers. My favorite memory during my hellish period was my pediatrician laughing and saying that a name that includes joy, she's just got to be wonderful. So that led us to Amy Joyce Smith and Dr. Sanjay Schwag at the Hill Park Medical Center. My husband and I were very new to the integrative medical approach. We were from the regime, you get sick, you go to the doctor, you get medicine, and you get better. So within minutes of sitting with them, we shared our family history, the good, the bad, and the very unhealthy. The results were amazing, and with our family history and through Paige's blood work, we found that she was positive for celiacs, as well as my husband and my son, because of the further testing. I will be honest, I was a bit of a skeptic with urine samples and multiple trips to the phlebotomist with my husband and children in tow and endless hours of reading labels in the grocery store. I was questioning, can I do this, and is it all worth it? But over time, with the antibiotics, the tailored health supplements to heal Paige's brain and gut, the IVIG, and with our new gluten-free lifestyle, our Paige began to come back. I began to believe in this integrative approach. And because of this, we actually ended up finding out my son, who was 4 at the time, all of a sudden just started having enormous issues with aggression and hate. He even said that he hoped his sister had died. At one point, he tried to get out of his car seat while I was driving. And so I called Amy, here we go again. I'm ready to do the blood work for PANDAS. And what we came to find out is that he was eating Ritz crackers at preschool. So really, how much the gut is correlated to the brain. And it's just amazing. I feel like I can't learn enough. So thank you for everything today. We are so fortunate that Amy had answered our emails 3 years ago, and as our PANDAS story could have such a different outcome. The attention, the testing, and the interventions that were conducted to get to the root of Paige's illness ultimately changed the lifestyle in which our family leads today. So thank you, Amy, for everything, for my family, for the support you have given to so many other families and children, for the advocacy of making PANDAS well known, and for this amazing day. So without further ado, I would like to present the incredible Amy Joyce Smith.
As a mother of a child with PANDAS and as a provider to so many children with PANDAS, I feel like I have a little bit of a different perspective and a different role here in the community, because I have a foot on one end and a foot on the other side, and I really kind of get how it all fits together and where it doesn't fit together and who's thinking what and who needs what. You know, as a PANDAS parent, I spent years starving for someone to tell me what information would help my child and how to treat my child. And as a PANDAS provider, I feel like I'm starving for information and someone to tell me how to treat your children. So, and there's definitely a gap in there. So we are really lucky to be here today with the most forward-thinking people out here, scientists and medical professionals and researchers looking at PANDAS, trying to understand it, and trying to put together one of the most complicated, nuance-laden situations. Medicine is really, really good at finding a single cause and a single effect for a specific illness. They're really, really good at doing that. This is so complicated. It could be almost anything. We've seen that. We saw that in what Jenny's talk was. We saw that in Dr. Cooperstock's talk. Dr. Larcio certainly alluded to so many different infectious triggers and environmental components and innate factors, things that we just bring to the picture kind of under the hood when we're born, that all together they just turn into PANDAS. And we don't know why. And many, many children, every child is practically different. You know, any provider has the luxury, any PANDAS provider, some children are going to come into our practice and they're just straightforward PANDAS kids. They walk in, they have a very, very specific story, they know their date. Mine was July 7th, 2006. Just like Sue Sweeto said, everybody has their date if it's really PANDAS, or certainly a week or a range where this incredible eruption of symptoms occur. And then you give them antibiotics because they clearly have strep, and then they get better, and then they go home. And that is so nice, and it's also very rare. It's very, very rare. And so this slide, this is actually the only slide that I brought today. This slide becomes my Bible. I actually kind of draw it out a lot of times for parents because I think that this is so incredibly important. You know, PANDAS, we've certainly talked a lot about that, includes infectious triggers and non-infectious triggers. And Dr. Cooperstock talked a lot, as did Dr. Frankovich, about all the different types of infectious triggers that are being looked at. There's strep, there could be staph. I've definitely seen a lot of nasal infections, nasal staph, and other microbes. I'm going to talk a little bit about Lyme later because I think that that is a big issue that is not being fully addressed in some of our children. But environmental factors are also really important, and one of the things I'm going to do is tell a few stories about things that I've been learning from patients. We're all learning, you know, about this from our patients. Of course, my first patient was my child. And so he also had a particular burden of being a guinea pig, and he's let me know many, many times how uncomfortable that has been for him. But I also know how grateful he is because he has a life that just a year ago, we had no idea that he was going to be well enough to go off to college with a full scholarship, I just have to add, to USC. To live his dream life. That was absolutely uncertain, and certainly 2 years ago, it was really uncertain. If you would have seen me 2 years ago, I probably looked 10 years older than I do today. The things that we have heard here today are really on the forefront of thought, and like Dr. Cooperstock said, with the vaccine that might be around in 10 years, it is going to take years and years and years and years maybe before the information here becomes consolidated and proven and published and printed and taught in school and in continuing medical education courses, and sifts its way all the way down into every pediatrician's office, where when somebody walks in, you know, in Boise, Idaho, and their child has an acute onset neuropsychiatric symptoms, that nurse practitioner that sees that child is going to say, oh, I read about this. This is what we do when we want to consider what this is about. This child deserves a physical workup first. Maybe they ate rat poison. I mean, who knows what is going on with that child? Environmental factors could be anything. Somebody could have sprayed pesticides next door that particular child has trouble breaking down, or they could be poisoned from so many other things. Or like Addie said, and we'll talk a little bit more about gluten and other autoimmune things or other inflammatory triggers that were really already going on. And obviously, we're all of the one mind that children deserve a physical workup first before a psychiatric referral. But it's going to take a really long time for that information to sift down. And so the problem with that is that you all are going home to sometimes providers that just don't know what to do. They don't know what to do. They don't have this information. They may not be here today. And I do want to let you know, because I've been told, I neglected to tell you earlier, that all this is being filmed and it will be posted on YouTube over the course of the next few weeks and, possibly months, depending how long it takes. But everyone is really going to have direct access to this information. So I just want to be sure that you know that. And share it. It's really up to everybody in this room to share it, and we're going to talk more about advocacy this afternoon, how we can take our individual story and pain and turn it into a collective, powerful dialogue where we can actually make a difference with the information that's being presented here today. But for our children and for the kids in school today, this gap of information is what we have. And I am certain that when a provider doesn't know what to do with a child that's being presented into their office in absolute breakdown, that the answer is never nothing. That is never the right answer. And, but the problem is that they're looking for evidence. They need a protocol. They need diagnostic criteria because the medical model is such that the doctor knows and they know how to tell the parent. And that is not the kind of model that works for us anymore. The other day, I had a mom in my office who is a mom of a PANDAS child who also has autism. And about 80 to 90% of my practice is PANDAS, and or PANS. And we were talking about how providers really don't know. They just don't always know everything anymore. Things are so complicated. And if they think that they have to know, and then they're paralyzed because they don't know, that's where the problem is. And parents with autistic children, this woman was telling me, long ago learned that they were the ones that really had to figure out what it was that they thought maybe might work with their child, and then the provider, if they were really open, would be willing to have a discussion about it and listen to it, maybe go and do some research. Maybe they could research together, but they weren't afraid to share the risk of trying something that has yet been untried. We have to generate new knowledge in our practice every single day for the 1 in 200 children in the United States, at the minimum, that have infection-triggered neuropsychiatric syndrome. We have to be absolutely as brazen and courageous as the parents are day in and day out as they blog to their, heartbroken energy on these Facebook pages and on all these other social media sites, treating each other's children and teaching each other about cytokine pathways and histocompatibility complexes and so many things that sometimes I don't even know what they are. You are amazing. You're amazing. The providers need to be somewhere on the scale of as amazing as the parents are. And, okay, even if we don't really know what to do, and parents don't have control, so they need the provider to be willing to take risks and work with them. And Dr. Larcio definitely alluded to the risks of being a provider that breaks the rules. You could get in trouble with the board. You could be sued oh my God. You could be sued for breaking the rule from some mother or, frantic, crazy parent, because we're all frantic, crazy PANDAS parents. And I have to say that one comment that Sarah Jane read about what you hate worst about your PANDAS life, that was my comment, my fucking PANDAS life, all right? That was me. All right? And we've all been on there. These blogs on Facebook, it's PANDAS hell. That is the common term that we use to talk about life. Here I am back in PANDAS hell, and everybody knows how to rally around that person because we've all gone in and out of that place as long as our child has fallen off the end of the known universe. So control. Providers need to find a way to get some sense of control back into the hands of parents. So when I came back from the Northeast Conference, I had a strep infection within 24 to 48 hours. I was so sick, okay? And so I came back on Sunday. By Wednesday, I was at work. I was so sick. I knew I had a fever. I did a rapid strep test. It was blazingly positive. So I went home into my incredible medicine cabinet that has 17 different antibiotics, because you just never know what you're going to need or what you're going to take based on what's going on that particular time. And I, tapped into my Zithromax, of which we have buckets, and just started popping them. And, 3 days later, I was not better. And, Zithromax is kind of a magic bullet out here on the West Coast. I think it works very well for the most part with the majority of PANDAS kids. It's what we tend to start them on first, and because it also covers mycoplasma. And I feel very comfortable starting any child's protocol, even when we don't know yet what's going on, with Zithromax. There's fairly high effective rate and good efficiency response. Nothing. So then I remembered back to the East Coast Symposium where Dr. Sweeto and Dr. Beth Latimer said, maybe 30% of the time we are seeing cases non-remitting with Zithromax on the East Coast, and we're using more clindamycin. So I reached into my medicine cabinet because I still had some clindamycin from when Lance was having his tonsils out. I don't think we ever actually finished taking the whole thing. So I started on clindamycin. Okay, which I have to say, I was scared to do. I really was. I shovel this stuff out day in and day out to families and kids. And we ask our kids to take this. We don't want to take this stuff. It was scary, right, to take after Zithromax, clindamycin. I took clindamycin. I started to feel better. By the end of 7 days, I was just as sick as I was before, and it was strep. I took rifampin. Now, I could write myself a prescription for all this. That's really the point, okay, of this story. Oh, and I got better. In fact, within 1 hour of taking rifampin, that I was terrified to take this medication. It's like, rifampin, it's a big medication, but we use it. It's a powerful intracellular antibiotic. It's one of the most powerful guns we have out there. I was getting better within 1 hour. So, of course, I had to put Lance on rifampin because heaven knows how many bugs I've brought home to him during the course of treating PANDAS. And I got better. But, parents who can't write those prescriptions for themselves, what do? They're really stuck, right? And so we as providers, I really want to invite us to open the door to help them gain some control and to respect the intelligence and the research and the information that they have, and let them lead us as providers to solutions for their children. Even if we don't know. And just speaking about what we don't know, in that vein, I just want to mention a few stories because I think we can all get up here and talk for a long time. I want to talk a little bit about the stuff down there. First of all, environmental factors. Because we can only test for what we know to test for, and we're always learning stuff from our patients. So I had a couple of patients that taught me a lot about environmental illness with PANDAS. One is a child whose dad is in the room. He seemed very straightforward with PANDAS, 6 years old, sudden onset, all the criteria. Treat him with antibiotics and some anti-inflammatories and kind of seemed to get better, but it went up and down and it wasn't really remitting. And I was talking to his mom on the phone, and she said, you know, when we left the house and we were down in Disneyland, staying at a hotel, he got better so fast, even just being in the car over 2 or 3 days. He was so much better. And by the time we got back to the house, after one night, he was right back to where he started from with his tics and so on. And thinking about another child I had heard about with environmental triggers in their home, I said, there's something going on in your house. Let's think about it. Maybe it's mold or something like that. And so while the mom was on the phone, while I was on the phone with the mom, I had her just look around the bedroom, look under the bed, look on the windowsills, just look and see if there was anything. And this little boy had been sleeping in his parents' room on a mattress, which happened to be, if I'm getting this right at the doorway where the bathroom comes, like the steam from the shower and so on. That mom, I was on the phone with her, picked up the mattress. It was loaded with mold. The entire bottom was smothered in mold. Who would have thought? Who would have thought? I'm like, okay, great, we found it. Get your kid out of the room, get the mold out, get the mattress out, have, remediation done, get an air purifier, whatever. That was like Thursday. Monday, I called her. He was so much better. He was so much better. I have another child who also, his family is in this room, who we never actually figured out what was going on in their environment, but it became so clear from so early on that whenever he went to stay with his grandparents or his grandmother, he got better, and then he got sick again when he went home. But yeah, that's so complicated. You can't make assumptions over things like that. Could be anything, could be family dynamics. It's so complicated. But this pattern repeated and repeated, and it wasn't just the grandmother, and it was even if he was gone with his parents to the mountains or to Tahoe, it didn't matter who was present in the scenario. So finally, this child, his OCD was so severe that he was spending, and I am not exaggerating, 14 hours a day standing in the shower while his mother had to scrub furiously the bathroom and the tile and the toilet and the sink and everything for hours and hours and hours a day. And when he wasn't in the shower, he was laying on a towel on his mother's bedroom floor, afraid to touch anything at all, except like a gadget, a computer toy or, a game, which all of our kids get addicted to, by the way. But what is that? So this family picked up and left their house. And 3 weeks later, 3 weeks, this child was standing in the shower 1 hour twice a day. And the night before, I talked to his mom on the phone. He was playing on the Wii with his family. That is amazing. We don't know what was in their house, but that has to be on our radar as providers. We talked about gluten. You talked about that. I was so grateful that you did. So I'm not even going to go there. But I only have a minute left, and I know that doesn't even begin to do justice to say the word Lyme disease and co-infections. Lyme disease and co-infections. Tomorrow morning at 9 o'clock, I would like to have a breakfast meeting for anybody who is able to stay over or lives close by and would like to hang out in the atrium while we're having some breakfast meetings and talk about Lyme, okay? But I'm just gonna say one thing because my time is up and we're running really, really over. Lyme is, we see it a lot. We see it a lot in our practice. We see it about 30% IgM, CDC positive, testing for our PANDAS population. And for kids that think they have PANDAS and it's not exactly PANDAS, about half the time they have Lyme. So it is really important. I can talk about all the flaws in the two-tiered testing system. It is well documented, the sensitivity, the percent of Lyme that actually gets picked up in this system is 56%. I'm out of time. So I'm just saying, think out of the box. All of us need to think out of the box. Thank you.